Welcome to Adapting Class. This is a neurology questions on autonomic dysreflexia to give you content related to that. At the same time, we practice some questions, 10 questions, but it's all content related to show you things you need to know about this specific condition. There's several ways they're going to ask you questions that can trick you, but at that Adapting Class test taking strategy and content mastering will get you through these questions easily. They are tricky. You want to stick around and watch all of them. So let's get to it. First question, reading from the back. Which statement by the client indicates the possibility of what? Impending autonomic dysreflexia, right? Which the nurse is assessing a client with T4 spinal cord injury. Autonomic dysreflexia is a changes in your hemodynamic status. That is why we call it autonomic dysreflexia. It's in trouble because of the loss of spinal cord injury above usually T6, right? Anything below your lower extremities does not work. There's no sensation, there's no movement, everything is up. And your body try to ramp up to figure out what is going on. It look like an ICP presentation. And so the circulatory system is trying to figure out what to do with your neurological system. So who is in trouble? I feel like I have really bad headache. You see, it look like ICP, too much blood in your head. My leg feel really warm and tiny. Like I told you, this is trap. People don't understand. I've seen a bunch of people make mistake regarding this particular question. Watch for it. If you have T6 injury, anything above here, yeah, you can feel it. Below here, you cannot feel it. If you have no sensation here, how can your skin be warm and tingling? You can't feel anything in your legs. The question said legs. The answer choice said leg. It's a trap. Feeling in your leg, you don't feel anything, right? You can't feel it because there's no sensation, right? So that's the key. So what you can mostly will be cold or something like that, but you're not going to feel anything. I feel very thirsty all of a sudden. It does not relate to thirsty or feeling the need to drink. I feel short of breath. It has nothing to do with your respiratory. I told you neurological status and your circulatory system. So this one is your right answer. And this is what I said. Other signs include flushing, sweating above the injury, right? And below it, there should be no flushing or there should not be warm, tingling sensation below it. It's a trap. Which finding places the client at greatest risk of developing autonomic dysreflexia? The client is admitted with the hospital with a history of what? T4 spinal cord injury. Same thing. What are the triggers? Stimulation, excessive stimulation, which can come from your bladder, your rectum, or your skin. Those are key. And then extreme temperature. Four things you should not forget. Extreme temperature, stimulation from your skin, your bladder, and what? Your and it's two, impaction or hypertension, right? So this blood pressure is normal. A kink urinary catheter is a problem. It can cause bladder distension. Respiratory rate, it has nothing to do with your respiration. And urinary tract infection, this is a tract infection, is not a primary problem. It's not the primary, it's right. It's not a primary issue, right? It's a secondary, right? It has no direct indication for stimulating you. That's the key. The distension will do, but urinary tract infection is indirectly related, so you should not pick that. Okay. Number right answer is bladder distension. Which medication should the nurse anticipate? A client with what T4 spinal cord injury is admitted to the emergency room with what severe hypertension, one, throbbing headache, and bradycardia. This is like Cushing phenomenon. It's like ICP issue. And diaphoresis because of the autonomic effect. Your nerves are trying to figure out either to secrete sweat or anything like that above the level, you see, above the level of the injury, not below the level of the injury, always above the level of injury. Despite removing causative what? Stimuli. That means you causative stimuli. That means you remove all the things that causes the stimulation, the blood pressure remain high. That means you check the bladder, you check the rectum, you remove constrictive clothing, you have raised the patient head up to decrease the hypertension. Still, blood pressure is too high. That means you get it treated. The best medication is to prevent tachycardia. So you can give them adrenaline or labetalol. Labetalol is the most effective. Atropine will increase your heart rate. It does not affect your blood pressure. Dopamine will decrease the blood pressure, but it will increase your heart rate. But it's not effective. It cause tachycardia. And mannitol is for ICP. So labetalol is the best choice. Which statement by the client indicate the need for further teaching. A nurse is teaching a client with T5 spinal cord injury how to prevent autonomic dysreflexia. I'll give you the key aspect, the content related to the problem. What is that? Overstimulation will include impaction, distension, hypertension, extreme temperature. So what is the patient saying that need further teaching? That's the concept related to the question. I will empty my bladder regularly using a catheter to prevent distension, not infection. I should check my skin daily for pressure injury. Pressure injury will stimulate your skin, right? I should limit my fluid intake to prevent bladder distension. If you don't drink or you get dehydrated, you have urinary retention, that's a problem. I need to keep my bowel movement regularly, prevent impaction. Therefore, no drinking is bad. The next client should increase fluid intake to flush things out. What is the priority nurse intervention for a client? A nurse is caring for a client experiencing autonomic dysreflexia. What should be your priority nursing action? Prevent further ICP pending injury. Place the client in high follow position. Give the patient pain medication. Encourage deep breathing and cooling blanket. I told you they have diaphoretic for the skin above. And the main problem is cardiovascular complication and cardiovascular reduction. Raising the head up will decrease the blood pressure, decrease blood flow from the head, and prevent the ICP injury due to hypertensive encephalopathy. Pain medication is not going to release the problem. It's pressure and a distension. Selected apply. Which of the following clinical manifestation the nurse should expect in a client with autonomic dysreflexia? I've given you all the information. Now I'll give you selected apply to put it back together and connect it together. Pick those that you're confident on, but pay attention with the concept. It's not too difficult. You know what it is. Write it down. What is autonomic dysreflexia? The blood pressure is going to go up because hypertension, blood is pulling in your head, and your blood pressure, is cardiovascular system is ramp up. You're going to look like you have what? ICP issue. ICP, your blood pressure is high and your your heart rate is low, bradycardia, right? I told you the skin above the area of the injury, above T5, is going to get warm. The skin below is going to get cold because it does not feel, there's no nerves going there anymore to stimulate, right? So this skin, that's why you don't feel too much. So pale skin below the injury. Warm floor skin below the injury never happen because there's no nerves going there. Pupillary dilation, no, this is not the brain injury problem. Which activity? So you have to understand the reason why it is very important to understand the reason why the skin going down below the injury is going to get cold is because of excessive vasoconstriction, and the nerves cannot function the way they're supposed to. But upper extremities, yeah, they will do, and then they increase, they flush the skin, and the skin get flushed, the blood pressure goes up. So always above the injury is flushed, below the injury is cold. Which action should the nurse take? Selected apply. T4, spinal cord injury, throbbing headache, flush face, and diaphoretic. These are autonomic dysreflexia. As soon as you hear T4, those are the things you worry about. Which action you want to take? Reduce the blood pressure, take care of the flushing and everything. So what is the first thing? You know the baseline is due to stimulation. Remove constrictive clothing. Place the patient head up to lower the ICP related to the head, no lateral. Check bladder distension. Is it stimulation? Check the rectum. Also stimulation. Measure blood pressure and see how high it is. Those are our features. What is the next action? The client with the T3 spinal cord injury is experiencing autonomic dysreflexia. The nurse has already raised the head, so head is up. That's the first thing you do. And remove constrictive clothing, everything, abdominal binder. Blood pressure still remain high. What do you want to do? What do you want to do? I take the patient head up and remove constrictive clothing. You should check the bladder. You should check the Foley before you give them medication. Nitroglycerin patch is not the best option. You want, if you have to control the blood pressure, you have to use something that can take care of it right away. Check for fecal impaction is the most important one. Administer opiate is not related to pain. Initiate a rapid bolus is not indicated. Which of the following client is highest risk for developing autonomic dysreflexia? T6 injury and above, right? C5 is good. This is below T6. Stroke is not related. Guillain-Barré syndrome is not related. The client with T4 spinal cord injury complain of a severe headache, flushed skin above the injury, and blood pressure 90. I'm trying to make sure you understand the concept. So all the signs and symptoms are there. What is the next first action? Lower the head of the bed, bad choice. Give them adrenaline, it's never the first choice. That's the last one. Check nauseous stimuli, like your bladder's distension. Telling the doctor about it is not going to help. The time you leave the patient to go take the phone to call the doctor, you're wasting time. ICP going up, headache is going up. They have hypertensive encephalopathy. Therefore, check for stimuli. This is the end of it. Thank you for watching. Thank you for being a member. Good luck in your exams. Bye.